12 symptoms which indicate you had a silent stroke and that another one will follow. 12 symptoms of a stroke. The symptoms of stroke usually depend on the area of the brain that is affected by the shutdown of brain supply. In order to prevent serious damage and a life of disability, it is very important to recognize the symptoms of a stroke and know their meaning so you can seek a medical attention quick enough. 1. Pain on one side of the face. Unexpected and unexplainable pain on the side of the arm, face, leg, or chest is not typical, but it is not uncommon. Women have a higher risk to experience atypical stroke symptoms. 2. Blurry vision. Inability to see clearly, blurred or double vision, inability to focus your eyes, or some other changes, in one or both eyes, can be a sign of stroke. 3. Difficulty breathing or swallowing. In most cases, women experience different symptoms of a stroke compared to men. Some of these different symptoms include having difficulty swallowing or breathing, sudden pain, seizures, hiccups, fainting, irritation, nausea or vomiting, and hallucination. 4. Tremors. Even though hand tremors are not that common symptom, it is confirmed that it is a symptom of cerebral infarction, obstruction of blood supply to the brain. 5. Loss of balance. Loss of balance, lack of coordination, and sudden dizziness can indicate a stroke, and you should take them seriously. 6. Difficult to walk. Instability and trouble with normal walking, and sudden tingling or numbness anywhere in the body can indicate a stroke. 7. Facial paralysis. This is definitely the best known sign of stroke. Sudden weakness/paralysis/numbness of one side of the arm, leg, or face can indicate a stroke. According to the Mayo Clinic, you should raise both arms over your head at the same time. If one arm starts to fall, a stroke is in progress. Also, one side of your mouth may droop when you try to smile. 8. Headache. This headache is not like a normal headache or a migraine. This is a sudden, monstrous, and sharp pain in the head, particularly in younger people, and it usually indicated a stroke. Women have an increased risk to experience a stroke headache compared to men, particularly women who constantly suffer from migraines. 9. Confusion. This is another sign of stroke. If you are in the middle of doing something and suddenly you become disoriented, confused, or unable to think straight and understand. 10. Vertigo. Dizziness or imbalance alone do not necessarily indicate a stroke. However, dizziness and imbalance accompanied by vertigo indicate a brainstem stroke. The prognosis for brainstem stroke is very good. There is a chance for recovery from a brainstem stroke because brainstem strokes do not affect language ability, so the individual can participate more effectively in rehabilitation therapy. According to the American Stroke Association, double vision and vertigo often resolve after a few weeks of recovery in mild to moderate brainstem strokes. 11. Trouble speaking. The part of the brain responsible for speech is usually affected by stroke. When having a stroke, you will experience an inability to speak, slurred speech, or inability to understand speech. 12. Fatigue. During a stroke, women have a higher risk to experience sudden extreme weakness, fatigue, confusion, and changes in mental state. Preventing stroke. More than 80% of strokes can be prevented. In order to reduce your risk of stroke, make sure to follow these lifestyle choices. Keep your blood pressure regulated. It is very important to keep your blood pressure less than 120/80. Maintain a healthy weight. Your body mass index should be 25 or less. Exercise regularly. It is recommended to exercise 30 minutes at least 5 days a week. Limit your alcohol consumption. You should drink no more than 1 glass a day. Keep your blood sugar levels regulated, especially if you are diabetic. People with diabetes are more likely to experience stroke. Stop smoking cigarettes. Fast for stroke. To prevent permanent damage or death, you should immediately seek for medical attention, within 1 hour, when experiencing the symptoms of a stroke. You can use some medications that have the ability to quickly dissolve blood clots, thus remove the obstruction and get the blood flowing again to the brain. Having proper treatment within 3 hours of experiencing symptoms of a stroke is related to a 30% greater chance of not experiencing serious harm. The medical experts use the mnemonic acronym FAST in order to increase the awareness of the symptoms and to teach us what we should do if someone we know is experiencing a stroke. If someone you know is experiencing a stroke, the first thing you should do is call for an ambulance immediately.